Now, awesome. Okay, so welcome everyone. Thank you again for joining us for today's admissions information session. My name is Mark Coven. I am the Director of Recruitment, Outreach, and Admission. And we have one of our amazing team members. We have Jamie Gama. And then we have Nelly Asensio, who's actually on maternity leave. So she has a beautiful daughter. So they're taking care of one another. And so we wish her, a happy recovery and hope to get her back pretty soon. But for today, again, we're going to be sharing information about our Master's Entry Clinical Nurse Program. We love to use acronyms right here at UCLA, probably just like any other university. So we like to say MECN, keep it MECN for short. That way you don't have to tell your friends and family that you're applying to the Master's Entry Clinical Nursing Program. Just go ahead and say MECN. And of course, we want to make sure that as we start to solve, first and foremost, this is a fast-paced full-time master's program, right? So I'm assuming everyone out there either has completed their bachelor's degree or will be completing their bachelor's degree before they enter the program. And so, yes, this is a master's program. So when you graduate, you will receive your MSN. Which is your Master of Science in Nursing, which will allow you to sit for the NCLEX, which is your RN licensing exam. Okay, so yes, we do want to make sure that you guys understand what the MECN program is. Really quickly, I do believe Jamie just provided a link. That is going to be to our Master's Entry Clinical Nurse, the MECN program tip sheet. It should be the same link to where you guys, again, also signed up. But if not, feel free to download that link there. You guys can use it as we continue throughout today's information session. Really quick, here are just some timelines that we have. We'll try to stick to them, but more than anything, which is the most important part, we'll definitely get you out before 3:30, depending on how many questions we have and how many answers we can go ahead and provide for you. It could be anywhere between 3 to 3:30, but we promise to answer all of your questions. Okay, so I'll continue on with the introduction and curriculum. And then actually, instead of Natalie, we'll have Jamie. She'll go over how to provide a successful application. And then we have Leonie, who's our Director of Financial Aid. She's provided a video for us. It is a year outdated, but the information in term that is useful and that is correct are going to be the deadlines. The tuition might be slightly off, but again, that you can look at our tip sheet. I'm sorry, yeah, our tip sheet or the whole information packet, I should say. And then again, we'll finish it out with the closing question and remarks. So what I would like to do is do a quick pause. We do have about a 3-minute video that we have on our YouTube channel. And what it does is it predicts what our simulation looks like for our students as they enter the program before they actually get into their first clinical rotation. They will also be doing their simulation lab work throughout the duration of the program. But what we really want you to kind of think about and simulate is what it's like, right, in terms of to be in a hospital or clinical setting. So what we do is we use real life mannequins, right? So they talk, they bleed, they give birth, they do everything, right, that us humans do. And so what we want is to replicate, right, again, a hospital setting. So it really helps prepare our students before they get into a clinical environment. So I'm going to do a new share and hope that this works. So give me a quick second here. Just have to find it. Where are we? Da, da, da. Okay, so it's going to be here. Let's do a share sound. All right, and it should be here. I'm going to press play. Jamie, if you can give me a thumbs up to let me know that the sound is working, that would be great.
Good morning. How are you? Good to see you this morning.
Discharge instructions?
Yeah, we're just
It stopped working, the audio. Maybe you unmute yourself.
Okay, let's see. Thank you again. Let me see if I can do this, and I might have to do share sound. Oh, wait, here. I'm not sure why. Let's go back to the PowerPoint really fast and see if the video will work. Where are we? Let's see. Oh, which one are we looking at? Sorry, I'm all over the place. Where's the Wi-Fi? Okay, here we go. Let's try it one more time, maybe.
Simulation is a very important piece of the training. It takes a student out of a lecture hall and puts them more into a clinical setting. We have mannequins that have ability to mimic a lot of different patient aspects.
They're able to breathe, their chest rises, they have coughing, wheezing, lung sounds, crackles.
A lot of the higher tech mannequins actually sweat. We can change their pupil sizes. And by computer, we also can change any vital sign similar to a real patient. It's a way to get the students more engaged and to get those clinical experiences such that they don't have to actually practice on real patients. ICU simulations are to mimic the environment in an ICU, to add some extra stress, to add some extra equipment that the nurses have now been trained on, and then depict some kind of event that would be typical for an ICU and see how they can react to that event and intervene to make the patient better.
There's a lot of instances where things happen right away. You have to respond right away. It's been able to help me practice my emotions, help me practice how I deal with things.
What's great about simulation is that the student actually gets immersed into a situation. When they get to the ICU environment, it's not foreign to them. The leadership simulation that we do is done for senior students who are nearing graduation. We have 5 patient beds with mannequins simulating an actual clinical floor.
You come in and your nurse will give you maybe like a fast report. They have to go somewhere.
He's a 60-year-old male that was admitted several days ago for an exacerbation of his asthma.
You go to your patient rounds and you go, first patient, okay, you check on them. How are you feeling? Like dizzy? Then you hear like a bell from another room.
Okay, I'll let her know.
I'll be quick. Okay.
The goal is to give them a little bit of stress because we want them to be able to think as a nurse and to be able to think on their feet.
So, Mr. Salter, you're having very low blood pressure.
It can certainly be that chaotic during the day. And that's why we have this for practice to put us in those situations so we can learn how to think, what to do.
After each of the simulations, it's really important to come together and have a debriefing. The whole point of the debriefing really is for them to reflect on what they were thinking when they did different things. And then if they would do anything different, how would they do it different?
It's really helped us boost our confidence and also helped apply everything we learned in the books to what we see in the real world.
The goal of simulation here at UCLA is to send students out into the clinical world more prepared and better able to tackle some of the more difficult types of cases that they're going to come upon.
All right, awesome. Thank you all for sparing me with that. So let's get back to the PowerPoint here. Okay, so let's continue moving forward. So again, so some of this may be repetitive, but again, we just want to make sure that you guys are understanding what this program entails and what it does have to offer. So again, this program, again, is going to be designed for individuals that have a bachelor's degree in another discipline, that wish to enter the nursing profession. This also means that you may have a master's degree, okay, and that's okay. You can still apply, but the minimum requirement is a bachelor's. You may have people out there that have 2 bachelors. That's okay. We will look at both. The university will most likely look at your first bachelor's degree when it comes to the GPA. But again, the minimum requirement for entry into the MECN program is going to be a bachelor's degree. As I was stating earlier, right, that this is a full-time 2-year program. If you want to break it down into how many months or how many quarters, it's about 22 months in length. And so you will start your first year, which is fall, winter, spring. And then you're going to have this summer in between, year 1 and year 2. And then you're going to start year 2 again, which is fall, winter, and graduate in the spring. So it is going to be about 7 quarters. For those that do not know, we are in a quarter system and it works every 10 weeks. Okay, so we start the program or the academic year towards the end of September, and the academic year finishes about the 2nd week of June. I know you guys are looking at the last bullet point there in terms of the number of students that we admit. And so we have a goal of admitting 70 students per year. Okay, I know we may have another question in one of, let's see, it's going to be here pretty soon, so I promise to answer that. But a lot of people like to ask, what does a typical student look like, right? And so that's hard because for the MECN program, we get people from all different type of backgrounds in terms of their undergrad degree, what their, first, profession is, right? And so we get people that were entertainers, people that were lawyers, people that were historians, people that were athletes, teachers, you name it, right? And so obviously this program is for anyone that has a bachelor's degree in another discipline, but everyone's going to have a reason and a passion and understanding in terms of why they want to become nurses, right? So what you're going to be looking at here basically is just the ages. And so the ranges, right, for anyone that's graduating at 21 or even 22 possibly, to people that are, in their later stages of their profession that want to end up taking on, right, a second career path. As we know, this is a female, predominant based profession. And so, of course, we're going to get more people that identify as female that are going to apply to the program. And so in essence, we're going to get more people that are admitted to the program as well. But again, we're not basing admission off gender, age or anything like that. But just to give you an idea of what it looks like. The average GPA is going to be cumulative, and that's going to be for those, again, that have completed their bachelor's degree at the time of application, and it's going to be from the institution in terms of where they graduated. The minimum requirement is a 3.0, but typically the average of admitted student is about a 3.48. So anywhere between a 3.4 to a 3.5 is typically what we like to say. And then a lot of people always ask, hey, does it matter, or is there a priority for someone that's graduated from a school in California or even maybe a UC? And so no, there is no preference or priority for someone that has graduated from UCLA or from somewhere in California. So we get international applicants, out-of-state applicants, as well as those from California that transition into students. I think the biggest takeaway here is to think about the different type of experiences that you have, right? And how, again, that relates to healthcare. And so people receive or earn or, experience different type of healthcare. And that could be through working, volunteering, interning. And so we'll talk a little bit about that later on. But think about how your current experience, how that relates and how that has helped prepared you to apply, right, to our nursing program. So a lot of people ask why UCLA, and if this is maybe your second, third, or who knows how many times coming to an information session, you've definitely heard me say this, but I'd like to use this example. I've been using it for a long time, but I do think it really captures why someone should choose UCLA, hopefully, as well as the School of Nursing. And I think the big thing is UCLA and in the School of Nursing, us feeling like we are a community, right, in terms of the UCLA as well as the School of Nursing. And so what do I mean by that? If you step foot on campus at UCLA, it is a big campus, right? So obviously here in Westwood. And so we think we're our own community, inside the realm of Los Angeles County. And so I always, throw out examples of here at UCLA, we have our own police department, right? So we have our own safety. We have our own transportation, right? If it's UCLA buses, if it's, Santa Monica, Culver City, LA Metro, to take our students as well as staff and faculty in and out throughout Los Angeles. We also have the best places to eat in terms of entertainment, places to shop. We have that as well. We have everything that we feel a community should have in terms of, being successful. And so if we were to kind of flip it on the academic side or an academic head in terms of what does the School of Nursing have to offer, right, in terms of the different resources for our students, first and foremost, all of our students are going to have their own faculty advisor. They're going to have someone here in the Student Affairs office who's going to help them in terms of the matriculation, signing up for classes, and help be, kind of the liaison with that. You are going to be participating in a mentorship program as well. So what we like to do is match a first-year student up with someone that's in their second year. And so part of that mentorship program is to really help them in terms of the ins and outs of the program, right? In terms of like facilitating, study groups or maybe passing down some study notes or guides, maybe offering some insight on professors, classes, how to study and so forth. So that part's really cool. We also have specialty coaches, which are individuals who have gone through the program, who come back to dedicate their time to make sure that our students are going to be successful in the program. And then we also have resources outside of the School of Nursing that we partner up with at UCLA, right? And so making sure that you're also taking advantage of what UCLA has to offer for our grad students as well. And so because of that, in terms of what UCLA has to offer in terms of its community as well as within the School of Nursing, we do feel that's what makes us one of the top nursing schools, right? And that is clinically, as you're getting into the hospital setting, that's for our professors that are going to be teaching you, as well as your sim labs. Okay, so here are some other things to kind of think about as we continue on, right? Is the application deadline, which is going to be November 1st. And so that actually is making me think about, and I know many of you guys here are probably thinking or maybe even asked already in the Q&A, why hasn't the application opened up yet? So we thought the application was going to open up yesterday, the 15th. That is what UCLA Graduate Division had stated. But they did say after the 15th. So that's something that, we caught ourselves. And so we're anticipating that it'll open up at some point this week. I'm pretty sure they're probably, finishing up the last finishing touches before they actually open up the application. But it will be due November 1st. So that deadline will not change. Again, so you'll have about a month and a half or so to submit your application. Know that, again, you have until November 1st, so it's not going to be October 31st. Again, you will have until the 1st. So don't worry. As you start the application, it is a save and continue, save, exit, or, re-enter, and so you'll be fine. Trust you guys will have plenty of time to submit your application. Jamie will take over at some point and go over the admissions process, talk about the prereqs, what to put for your statement of purpose, personal statement, resume, and all that good stuff. And then again, just to reiterate, right, there is a big difference between undergrad and graduate level work, right? That's going to make sure that, you're understanding that you are going to be in a graduate program at a master's level. And so our faculty do want you to come in with a graduate level kind of mindset, right? When it comes to your writing, your critical thinking, the number of hours that you're going to have to put in, right? You will be earning, right, your master's, your MSN. So think about that. Yeah, the classes and your clinicals will be on different days. They will be throughout each quarter and during the week. Typically, it's kind of changed throughout the years, but typically classes will be about 2 days during the week. They used to be Monday, or they used to be Thursday, Friday. Now I think they're like Monday, Wednesday. It just varies. And then your clinical rotations will also vary, as well as, getting those hours in at your sim lab. There could be an instance where you may have to come in for a sim lab on a Saturday or maybe even a rotation on a weekend, but it will be a Saturday if any, but just to give you a heads up on that. So more than anything, think about dedicating between 3 to 4 days a week, depending on the quarter. Okay, so goals of the program, right? Again, we just want to make sure that we're going to educate and provide a new workforce of RNs. That's self-explanatory, right? You guys may know that there is still a shortage of nurses, right? And so our goal is to make sure that every student that enters, that we will end up graduating them and that they'll be, prepared to work in high acuity and high tech healthcare settings. If it's at any of these hospitals that we're affiliated with, or even others that when you graduate and you apply to, right? But we just want to make sure that you will be a clinical leader. And that, when you graduate, you're going to have that UCLA across your chest, even if you go and start your, your profession somewhere else. And so here are just some of the hospitals that we'll be sending you to, and when it comes to your clinical rotations, but not limited, right? So of course, UCLA Health, which is Reagan, which is the hospital right there on campus, as well as Santa Monica. What I always like to say is we could send you down to 405 South, which would be Torrance Memorial, all the way back up to the 405 North, which is Dignity Health, which is Northridge Hospital Medical Center, right? Anywhere in between. So Cedars, of course, St. John's, the VA, there's Kaiser, Good Samaritan that we're seeing, CHLA, which is Children's Hospital of Los Angeles, for those that are interested in peds. But here are just a few just to outline those there for you. Okay, so I see you guys are asking some questions, so thank you, Jamie, for answering those in the Q&A, and I promise to pause and answer some as well. But again, here are some questions that we hope to help answer for you as well. Again, you guys may have heard me state that the minimum GPA requirement is at 3.0, so that is a requirement from UCLA Graduate Division. For those that do not have a 3.0, it does not mean you cannot apply. It does not mean that you would not be even accepted into the program. We have accepted students in the past who have GPAs under 3.0, right? And so there are going to be other parts of the application that are going to have to be strong, right? From the prerequisites, to, other parts of the app in terms of your essays and so forth. When will admission decisions be made? And so our goal every year is to release our admission decisions in the month of February. End of February is the ultimate kind of last date in terms of when we want to have them sent. But our goal is always, beginning to middle, right? That's always our goal. So you'll find out in February if you've been admitted, if you've made the wait list, or unfortunately you did not receive either one of those for this fall 2026. So again, that answer is number 3 in terms of, is there a wait list? Yes. So we'll admit 70 students, and then we'll also have a wait list of about 30 to 35 students. Okay, so for those that are on the wait list, we will initially send out our admission decision to our 70. And then from the 70, for any of those that have declined, we will go to our wait list. I know maybe the next question is, how many people do we usually admit from the wait list? That does differ from year to year. I will say this year, as our students are getting ready to enter, we got into the high 20s. Okay, so we got into the high 20s. We actually hold the wait list open up until the first week of school. And so we still actually have our wait list open just in case we have an individual that needs to withdraw for whatever reason. Do students or do you defer students into the next year? So typically this answer is a no, that the university does not allow deferment. But this is on a year by year, case basis. And so we won't know that until it gets into the spring to see if the university will allow deferment. But typically what we like to say is, for an individual, if you're going to apply for fall 2026, we hope that the goal is that you would want to enter and start in 2026. Again, we know things may come up, right, that may require, the opportunity or the option to defer. But again, we won't know until the spring. And then how often do you admit into the program? As we know, it's for fall only, so we don't have any spring, summer, or winter dates. Is there grad housing? Yes, so we do have grad housing available to our students. We have them for individual as well as family. And so we have grad housing. They call it off campus, but we have some that are still in Westwood, as well as some that are in the surrounding cities, Culver City, Palms, West LA area. How well do our students do on the NCLEX, and what is our retention rate? They're both in the 90 percentile. So majority of our students are getting ready to start, right? Let's say if it's our 70, they will be graduating 2 years later. Could be an instance where someone may need to get on a 3-year plan. And so we work with that student if that is something that is even available. And then for the NCLEX again, we are still waiting to hear back for the students that graduated in June. Most of them took the NCLEX exam in like August or so, late July, even August, as they're getting ready to start their new grad residency programs this month. And so we're still waiting to hear back from the California Board of Registered Nursing to see how we did. But in years past, we've always, again, been in the high 90%. 2 years ago, we had 100% first-time pass rate. So we're always excited about that. Okay, so before we get to the sample course sequence, let me just see if there's any questions I can help answer. But I will leave this sample course sequence up just for you guys to take a look and see how I can help answer some questions that you guys have. Okay. Okay, someone said, sorry, missed the admission decision date. No worries. So we don't have a specific date, but it's going to be middle to end of February. So we will notify everyone between the middle to end of February on their admission decision. Let's see here. Okay, have a few questions. Awesome. What are NCLEX pass rates? Yeah, for the graduating students. So again, we're still waiting to hear back. But last year, I think we're at 95%. The year before was 100%. And that's the first time pass rate. All of our students end up passing the exam at some point. Okay, and then also, what experience other than prerequisites are either required or recommended to have before applying and entering the program? So that's a good question. So we have nothing hidden in terms of what's required in order to apply. So it's just going to be our prerequisites. So you don't need to take any additional classes or anything like that. So our prerequisites are going to be required for entry. Again, we'll talk about those in terms of what specific grades are required and whatnot. But yeah, that's it. And other things that are recommended before applying, As we stated, it's just really having an understanding of why you want to become a nurse, why you want to apply to our program, and then have any relevant experience. And again, so we'll talk about that as well. Okay, someone's asking, does the time or duration, for example, number of years or months for volunteering experience, does it matter or does it make a difference? So for example, shadowing someone for a year versus 6 months, is there a preference? Not necessarily, because it just depends on how many hours someone did within that year span or that 6 months. So for us, it's really about what the individual had gained out of that experience, right? And so when you're putting it down in your resume, you could put the number of hours that you volunteered or worked. That's okay. Or you could put the duration in terms of the months or year. But for us, it's when it gets to your essays, it's really articulating how that has been beneficial for you. Okay, in terms of medical experience, does UCLA prefer paid over volunteer? No, we don't prefer either one over the other, that is. So you can have paid or non-paid experience. For us, it's just going to be, again, what you received out of it. You can separate them as you put them in your resume. That's fine. But again, for us, we just want to see what type of experience you've been able to gain. Okay, someone's asking, can you speak more about the prereqs required for the program? Yes, so we will get to that. We promise we will get to that. Someone is asking, is medical experience heavily recommended? It is recommended. I don't want to say heavily because we admit people that have all different type of experiences. So the best thing is to talk about, even if you have non-healthcare related experience, you want to talk about how that has, again, impacted you in terms of wanting to become a nurse. And so, yeah, if you have experience or if you don't, it's really about articulating that. Of course, people that have healthcare experience, they can talk a little bit more in terms of, healthcare, how that's been beneficial, right? So again, heavily, I think is a word that we don't have to say heavily, but having some type of experience would be recommended. Okay, I think I saw one here. Yeah, should we include non-healthcare related work experience in our resume? Yes. Include healthcare related, non-healthcare related work, volunteer experience, etc. Please put that in your resume. Okay, let's see. Just answer a few more. Okay, I see them coming in. All right, someone's asking, how competitive is the program? So we admit 70 students. We'll have a wait list of about 30 to 35. And this past year, we had about 450 people that applied. Someone's asking, does mental health experience working as a therapist count as healthcare? Yes, it does. Again, the biggest takeaway is explain how any of your experience is related to nursing. That's typically what I would like to say. All right, let's see. Someone is asking, does it matter if you don't have volunteer hours, but you work at UCLA Health? I don't know what you do working through UCLA Health. So again, it's all about the experience that you're gaining. If it's volunteering, if it's working at UCLA Health, it's all about how that relates to patient care, wanting to become a nurse. So that's the biggest takeaway there. Okay, let's see what else. Let's see. Do any of your students continue to work in clinical roles while attending the program? So that's a good question. If they're CNAs, ENTs, paramedics, EDs. Yeah, so we do. We do have students that still continue in their roles. It's all about time management though, right? In terms of, do they need to work? Do they want to volunteer? Is there family obligations and all that sort of stuff? But yes, we have students that do that. We have students that even volunteer with our faculty in terms of research. So there's many of things that you can do as long as the time management is there and it's good. Okay, some of these prereq questions, and so we'll get to that, we promise. Okay, someone more kind of experience questions. Does the experience need to be hands-on clinical or can it be non-clinical? Yes, again, it could be non-hands-on experience, it could be hands-on experience, it could be clinical, it could be non-clinical, all of that. It's again, all about the experience that you received again, and how that's been beneficial, and again, how you feel that has helped prepared you to wanting to get into a nursing program. So it's all about thinking about your all individual experience and how that's been helpful. Okay, another good question, and then we'll continue. Will the master's program allow us to advance into specialty roles? Or are bachelors generally only accepted? Okay, so I think it's a twofold question. So does the master's program allow us to advance into specialty roles? So graduating from this program, you'll be prepared to work as an RN to work any kind of clinical or bedside hospital, right? That does not mean that you will then become a nurse practitioner. That is a separate program, right? But you can work in a specific setting. If it's labor and delivery, if it's ER, if it's psychiatric role, if it's, whatever it is, you can do that once you graduate. But if you want to further your education in terms of becoming an NP, a CRNA, midwife, or whatever the case is, that would be an additional program and additional schooling. So good question there. Okay. All right. Really good questions. I just want to make sure some of here are about prereqs. Where we work. And let's see. Okay. All right. I'll continue. And I know Jamie's going to answer some, but again, we'll still continue and pause throughout today's session to answer those for you. Okay, so I did want to give you a sample course sequence really quick. And I know you guys have been stuck on this slide here again, but I just want to show you what it looks like throughout your 2 years here. So as you see within your first quarter, there is going to be no clinical rotation. That doesn't start until winter quarter. So first quarter, you have your simulation lab, right? So for fundamentals as well as your physical assessment. And then you'll have your ethics and your advanced patho. And then again, for second quarter, you'll start pharm, your patho, and then you'll have your lab, and then you're going to start your first clinical rotation, which is med-surg A. Then spring, finishing up your first year. In terms of the academic year, you'll have your research assigned, your pharm 2, secondary prevention, as well as your second rotation, which is med-surg B. Then again, you are going to have summer, right? So the summer is pretty full. You're pretty much here throughout the whole summer. And you'll do leadership as well as your mental health rotation, as well as med-surg. And then you can continue on with year 2. Okay, as again, you're seeing here for the clinical experience and how that's broken down, right? Again, so nothing for fall quarter. And then you start for year 1, med-surg A, B, and C, again, which is for the winter, spring, and summer. And then you're going to start year 2, which is maternity. Again, you'll have your L&D rotation. Winter is where you're going to have immersion. And so that's where you're going to select a hospital. Hopefully, as you've done your first 4 or 5 rotations, so you may have an idea in terms of what hospital you would like to potentially work at, and maybe even the floor. And then we work with our clinical placement team, and they, do their best to give you your top choice. And then, but what you're doing throughout immersion is you're really going to be simulating, right, like what it's going to be, as a future nurse, right? So your 12-hour shifts, with your patients and so forth. But along with immersion, there's going to be a project that's involved. And so if there's an area within that hospital and that floor that you would like to, make better, to increase, to enhance, you'll go ahead and create a presentation and a board for it, a poster board. Thank you for that. And then for spring, you'll finish that up with your public health rotation. And then you'll go ahead and graduate. Okay, time commitments. So again, UCLA, we have to put this out there for you guys because UCLA feels they've cracked the code in terms of how to be a successful student. And so they say for every unit that is taken, they want you to dedicate at least 3 hours per week, if that's inside or outside of the classroom, right? So if you have 14 units, 15 and so forth, but let's just say 14 for now, right? So that's gonna, times 3. You're going to dedicate at least 42 hours. And so again, that's per week, right? And so when we say full-time program, typically full-time job is going to be about 40 weeks or 40 hours per week. And so again, full-time program again, but you guys all know yourself, right? In terms of how to study, time management, and so forth. If this is going to be your first time in a grad program, it could be could work a little bit different in terms of, how you were successful in your undergrad. But again, we have all the different type of resources within the School of Nursing to make sure that you'll be successful. Okay, let me do a quick pause really quick, Jamie, to see if there's any more lingering questions. I know some people are asking some about the application, and so that's why we want to hold those. Okay, do have one here. Where's the public health rotation typically? So the most famous one is going to be at Skid Row. And so that's the most kind of famous one that our students participate in when it comes to public health. I do know some of our other students do other public health rotations throughout LA or even here on campus. But the most kind of famous one is Skid Row because that's obviously the area that does need the most focus in terms of public health. Okay, someone is asking, are students able to apply for additional certificates? So that's a really good question. And so, yes, upon graduating, most of our students, right, obviously you're going to graduate with your MSN, take the exam to get your RN license, but we do offer the public health nurse certification as well. So that is a separate certification that you would be able to apply to. We used to offer the CNO, which is the Clinical Nurse Leader Certificate, but we no longer offer that. So we just now offer that public health. Again, for those that may have an interest in public health, they'll be able to do that as well. Let's see. Yeah, someone's asking, will there be a financial aid section in the info session? Yes, there will be. Okay. Someone is asking, are there any opportunities for outpatient nursing experience? Not necessarily. That typically happens in our F&P, which is our doctoral program, but not necessarily for our outpatient. Um, that is more of a specific niche in terms of the specialty. Another question. What advantages come from having a public health nursing certificate? Is there additional cost? I do believe there is a different additional cost that will be provided to you if you decide to take on the public health nurse certification. But the only advantage is if someone that's interested in it, right? If you want to enter the nursing profession in the public health realm, we do know we do get students that have a public health undergrad, or maybe someone does come in with an undergrad degree in an NPH, which is a master of public health. So again, it's just all about what you would want to do as a public health nurse. Do most of the students take advantage of it? It just depends. But it's all about the interest in someone, if they're interested in public health or if they want to do other things. Okay. Someone is asking, is there a credential difference between the MECN and MECN programs? I wouldn't know, but the MECN is clinical nurse, where the MECN is practical nurse. So our program prepares students for bedside in the clinic. Okay, one more question that I'll help answer. This is another good one. Does the program help students or pair students with externships upon graduation? So no, we do not. And so what we do have though is students get ready to graduate in springtime gets ready to hit. We do have hospitals come out. So we do have like a hospital and job fair, as well as hospitals come and do presentations for our students to provide them information in terms of when the applications will become available, what they look for from the applicants and so forth. So that's what we do in terms of helping, but not in the sense of, like, do our hospitals provide, specific openings, like a certain amount, right? Like, will Reagan take automatically 20 students, right? Not necessarily. But we try to help out in the sense that we'll have the hospitals come out and speak to our students. Okay. These are great questions. We're going to continue to answer these, we promise. But I do want to stay on track just a little bit and have Jamie take over and talk about the application process. All right.
Hello, everyone. Thank you for being here. And before everything else, I would like to say that the application is not open. It's still not open. I checked a minute ago, and this will be the website where you'll go find the application. So this is the application that everyone who is seeking a graduate degree from UCLA this is where they apply. So you don't need to go to Nursing CAS or fill out a different application. It'll be just this one application. And we know as much as you know. So UCLA said it will be open after September 15th. It is now September 16th. It's still not open, but hopefully it will be open later tonight or maybe tomorrow. So please, we apologize for the inconvenience, but check back soon whenever, I would say maybe next week, okay? But some of you asked, there is no benefit if you submit the application early. You can wait until November 1st when it's due. So, but I understand, you know, the sentiment about this not being open. There's nothing broken. So you will go to grad.ucla.edu, you click on apply, and then you'll see the application portal once it's open. In the application, you'll have to select the application type. I would think that most people today, it will be a new applicant. So that means you've never received a graduate degree at UCLA, or you haven't been offered admission into a graduate program at UCLA. Because if you have, then you will be a readmit if you've already received a graduate degree at UCLA. Or if you deferred admission or you weren't able to come when they offer you admission, you'll be a renewal. But I would say mostly everyone today will be a new application type. Please make sure you select the correct program. This will be really important when it comes to your recommendation letters and everything else that you see as part of the application. Make sure you choose the major program that says Nursing, MSN, MECN. Transcripts, you'll see that there's going to be a section where you're going to upload transcripts. At this time, only unofficial transcripts are needed. So if you have a copy of a hard copy, like the actual printed transcript with you, you can take it out. And unfortunately, once you open an envelope, it becomes unofficial. But you can take out the transcript, take a picture, scan it, or you can go to your school's website if you still can and download an unofficial transcript. Please make sure that it says the word transcript on it, because we see a lot of students, sometimes they upload like grade summaries or something like that, but what we're looking for is your GPA and all of your class history. So it'll be an unofficial transcript, okay? So no officials are needed at this time unless you get an admission offer, okay? So we're keeping our fingers crossed. So everyone who's here today, we wish you the very best of luck. So if you get an official offer, then you're going to be sending us official transcripts. You can send them in the mail, but you also have an opportunity to send them via Parchment or other companies to our admissions email, okay? So you'll upload unofficial transcripts from anywhere where you got a degree or where you completed prerequisites. For example, if you went to a community college and maybe you took a dance class, that is not a prerequisite and it didn't count towards your bachelor's degree, then we probably don't need to see those transcripts or any certificates. We probably don't need to see those, but anything with where you took a prerequisite or your bachelor's degree, and if you have a master's degree, obviously, of course, please upload a copy of your transcript. And we also got some questions about of what the school looks for in an applicant. And so, you know, you'll have a chance to write 2 essays. We won't have any GRE or testing or interviewing in this program. So the reviewers will really look to your statements and they'll look for answers to these questions. Okay, so the faculty will be your audience when you write these essays. They'll want to see that you explain in your own personal story on why you want to become a nurse. You write from the heart, and basically your time to shine in the statement of purpose is your self-assessment for grad study. How well do you think you're going to do in a graduate program? The reason why you selected UCLA, your goals for a nursing career. I know somebody in the chat asked, what if I wanted to go become a CRNA? Oh, yeah. So if that's your main goal, you can by all means talk about your main goal if that's what you want to do in the future after you finish a program like ours. And any multicultural experiences, your bilingual ability, any challenges or adversity, and obviously all of your accomplishments. And we'll go over the resume and you'll see what accomplishments are really important in this process. Also, your leadership activities, because the school is looking for a well-rounded applicant, somebody who has pretty decent grades, but also who is a good leader and maybe someone who's also done some community service. And we'll go more into detail for the statements. This is one of the statements. So this is the statement where we say this is very critical. This is probably one of the most critical parts of the application. So you want to go to nursing school, but you have to articulate that in writing. And this is where we actually ask the graduate education to increase the words for us. So other programs, they do a little tiny essay, but you get the chance to type 1,500 words in this essay. So it's approximately 3 pages. And this is super important. This is the only way the reviewers get to know you. And this is used by the reviewers to know your academic interests, how well you're prepared for graduate work. And you'll see that there are some questions. They call them insight questions or focus questions, but you don't need to answer every question. Those questions are there as a guide, but you should focus this statement on the elements that you think are most important. Okay, so if you want something so important that you want the reviewer to know, then you will write about it in this statement of purpose. These are the questions. Like I said, these are general. These are pretty general. So everyone who uses the application will see this. But you can tailor them specific to you. You can tailor them to the nursing side. Like what I mentioned before. See the last here it says, what are your plans for your career after earning a degree here? So by all means, talk about your goals. What experiences have prepared you for this program? Okay, what additional information? And this is basically what you want to impress the reader and say, well, because I know what nursing is, because I've seen it with my own eyes, because I took the time to learn about nursing. I went to a hospital and volunteer. So this is where you make it look good, okay? Then there is a personal statement. So this shouldn't duplicate the statement of purpose because the same person is going to read both. It needs to be 500 words, but this is personal. So make it really, really personal. Don't make it general. Don't say the same information that you wrote about in the statement of purpose, but this is where you talk about you. Maybe some examples could be if you are a first generation college student in your family. So if you had any disadvantages for that matter, it can be educational, it can be financial, it can be personal, anything. So any challenges that are relevant to your academic journey, this is where you talk about them. So, but also at the same time, if you've had any challenges, then you talk about how you were able to overcome any challenges. And to keep in mind, the personal statement is going to double as your scholarship statement. Okay, so this needs to be 500 words. It's approximately one single spaced page with a 12-point font. Again, now for the letters of recommendation, we had some questions about this. These are suggestions that you should use a current employer supervisor. You can also use a college professor. You can also use anyone in a health-related setting. If it's a nurse, It's okay. You don't get extra points if they're a nurse, but it's okay. No family or personal friends. But say, for example, the college professor, if it's been a long time that you graduated from college, maybe 10 years ago, and you cannot find a professor or anyone who's known you well, then you don't have to have a college professor. So a nice mixture of people, it's totally okay. It's perfect, but just don't choose anyone as lateral. Like if you pick an employer, don't pick anyone in your same level. So it has to be a supervisory or a mentorship role. Also careful when you choose mentors, because mentors can sometimes fall into the personal friend category. And we'll talk more about what the recommendation letter it's really about. Oh, sorry. I thought we had one more slide, but about the recommendation forms. But once you go into the application, you can choose to enter your recommendations information. So you'll enter their name, their email address, their information, and the application sends the recommendation link automatically. Or you can also wait until you hit submit by November 1st, right? You hit submit, then they'll also get the link. Either way, they get an email from the application portal that says, so and so wants to use you as a recommender. And they will actually, this is where you also have to be careful when you choose the MSN MECN program, remember, as the application, because you have to please make sure that the recommendation letter you're sending to them says MECN program there. Because in some occasions, sometimes they choose the wrong program and they're going to send them like the PhD recommendation form. And so, this is a recommendation form. They have to rank you in different areas. One of the questions might ask them, how long have you known this applicant? So if they said they've known you since you were like 10 years old, it might fall again into the personal friend category, remember? So choose well. We usually recommend applicants to have your recommenders read your essay. Why not? If you're okay with that, and then they read your essay, they'll have a really good understanding on why you want to go into nursing school. So they'll rank you in different areas in this form. They can also do a written letter, but they don't have to. It's only optional. But they have a space there that they can type in notes about you. So, and also you have to waive your rights to see what anyone writes about you. So you can never see what they write about you, even if you become a student. So you just have to waive your rights and then send out those recommendation forms. We need a total of 3. You'll see that sometimes there's a space for a 4th one, but also because this is a generic application. So please don't fill out the 4th one, because if you do and you get 4 recommendations, we're going to delete one. And what if the one that was sent as a 4th one is like a really good one? We're not going to take the time to go over every letter to make sure, like, I'm sure you all get good recommendations, right? But we're going to delete one if you sent a 4th one. The resume, this is super important. It highlights everything. We reference to your resume for everything. So this is vital. The reviewers look to your resume for everything, your experiences. We please ask you to make sure that this is complete and that you give yourself credit for everything. It should be in a chronological order with the most recent on top. No, really, we don't have a page limit, but 2 pages should be good. But if you want to use more than 2 pages, that's also okay. But this is where you should reflect and give yourself credit for everything inside and outside of the classroom. So if you want to reflect any leadership, employment, community service, volunteer, any creative experiences, maybe you were part of a club or you did ballet, maybe, or you were a treasurer for a group, give yourself credit for everything, even if it's not healthcare related. But obviously, you know, the healthcare exposure is super important. So this is where you highlight the exposure on your resume. These are, this is, I don't like to go over this because this list keeps growing over years, right? So yes, I know somebody mentioned before, we asked for a lot and we added some prerequisites in the last few years. So this is the list. This is it, okay? So on chemistry, I know it can be a little bit confusing because when you see that it says Introduction to Inorganic, Organic, and Biochem, you think that you have to take 3 classes, but you don't. So I don't know if everyone knows that we have a page for every prerequisite. We have this humongous PDF file for every prerequisite except for English, because English has just got too big that, yeah, we couldn't manage it anymore because mostly everyone takes their written communication English classes maybe in the first or second year in undergrad. So, but if you have any questions, you can always email us if you don't see your approved courses on the list. It doesn't mean that they're not approved. It just means that they're just not on our list. Okay. So chemistry, it can be for some schools, if you see the list, for some schools it's 1 class. For Santa Monica College, I know it's just 1 class. For LACC, Chem 51, it'll satisfy the requirement. But if you took, for example, I know like if UC Davis, UC San Diego, you took like 4, you took the whole series of chemistry, you can use the best 2, the ones that you got the best grades. And just a reminder for all of the prerequisites, we don't require the lab portions of any of the sciences. We're only going to look for the theory grade. So no labs, but sometimes the schools will not allow you to take the class without the lab. But we, for admission purposes, only look at the theory grade. So chemistry, the verbal communication is the public speaking. Epidemiology, it's the only one that can be planned. So you can plan to complete this one. This class is only offered at universities. The community colleges don't offer epidemiology, but that's okay. It doesn't count against you. You can take, if you get an offer of admission, you can take the class at UCLA or at UCLA Extension or at UC Berkeley Extension. As long as it is an approved course, it's okay. So most people complete that in the summer. You'll need a human anatomy, human physiology. It's one of the ones that has a 5-year time limit. Okay. Microbiology, intro, general microbiology, stats. So statistics, it can be any statistics. It can be psychological statistics or biostatistics. We're pretty flexible with the statistics class too. The written communication, like I said before, it's something where I had a writing component, critical thinking. So you need 2. Intro or general psychology. This is the general psych. I know some people, they have a psychology degree, but they never took general psychology. I know, unfortunately, we cannot waive requirements. So same for like the communication. If you have a communication degree but you never took like public speaking, I'm sorry, you probably still have to take it. For the next one is the lifespan growth developmental psychology within 5 years. Nutrition, last but not least, also within 5 years. So no later than 2021 for 2026 admission. Okay, so you can also use, in this whole prerequisite group, you can use 1 pass, no pass for only one of the classes. You can also use an AP score. So if you took AP Psych or AP English, you can use it as long as you got a score of 4 or 5. And we will ask you to provide a AP College Board transcript. So if it's been a long time that you attended high school, it's probably a good idea if you're going to plan to use an AP score to start requesting the transcript now, because we will need to verify your AP score for the prerequisites. Okay, so All prerequisites other than epidemiology, remember? Epidemiology, it's okay. You can plan it. You don't have to have it. All prerequisites need to be completed by the end of December. So by the end of this year, 2025, if you're applying this year, all prerequisites have to be completed. If you're admitted, epidemiology can be completed in the summer before the fall quarter starts. All prerequisites must have a C or better, so no C minus, okay? AP score, 4 or 5 is acceptable. And this is where you can find on our website, you can find the list of the approved prerequisites for MECN. This is what we don't need. We don't need a GRE. We don't need the T's. Even if you submit the scores, we're not going to do anything with them. So we're not going to review them. And there are also no interviews for this program. If we have any international applicants with us today, this is the information you'll need. If you received your bachelor's degree in a foreign country where primary language was not English, you'll need to take the TOEFL exam. And TOEFL is the test of English as a foreign language. You'll need at least an 87 overall. Or you can also take the IELTS academic test. With the IELTS, you'll need a score of 7 or higher. This is the TOEFL website. It's the TOEFL.org. Our institution code is 4837, and the intended graduate major code is 43. Last but not least, remember, November 1st. So that's when the application is due. But all your transcripts, your recommendation forms, any fall transcripts are due by January 15. So when somebody completes your recommendation form, you can actually get an email. The system sends you an automatic email that says, so-and-so completed your recommendation form. What if by January 10th, you don't have any letters or something happened? You can go back into the application and replace a recommender, okay? But keep in mind, holidays are in between November and January 15th. So the holidays make it a little bit harder. So keep in mind, keep checking. You can go back into the portal. You can see who submitted a form, and you can press them in case they haven't submitted your awesome recommendation form. So by January 15, that's when we will need recommendation forms and any fall transcripts.
Okay, thank you, Jamie. Just answering some questions. So we have some questions that are still coming in. But a lot of people are asking about if you had questions about prereqs. Feel free to send it to our admissions at sonnet.ucla.edu. And we'll make sure to get back to you within workday. But if you had any specific questions that you would like to ask either one of us, feel free to do that. You see our emails over here to the right. But if you have any general questions, feel free to use our admissions at sonnet.ucla. So I'll pause here for a quick second so people can take a screenshot or even write it down. And we have some questions coming in here, so we'll take a quick couple of minutes to answer these. I did see one, someone was asking, how much does the application cost? We actually do not know that right now. We won't know until the application becomes available. The reason why we don't know is because they might have increased it, unfortunately, from last year to this year. So we just do not know how much it's going to be. But with that, the university does offer fee waivers, I should say. There are specific fee waivers that they accept, and so they'll provide you what those documentations are. So yes, there are fee waivers. Again, they will provide you with what that is or what is accepted in terms of the fee waiver. Okay, someone is asking, yeah, can you send unofficial transcripts to us for us to take a look to let you know what's acceptable or not? Yes, you can. Just email us at admissions at sonnet.ucla.edu, and we'll definitely do that for you. Someone is asking, is retaking classes, is it bad? Is is there a deduction in points? No. We accept repeated courses. That's totally fine. We take the highest grade that you want to submit. So that's totally fine. That happens all the time. On the application, do we include all college level courses that we have taken? No, you don't have to. We're going to see that through your transcripts. And we're only going to look at your transcript to calculate your GPA and or the other transcripts to ensure that you've completed the prerequisites. Someone is asking if they received an F or an W for a prerequisite and they retook it and got a B, will it be impacted negatively? No, we will take the highest grade, as stated before. Someone is also asking, do we do one-on-one appointments? Yes, we do. Jamie, if you want to drop that link, we do advising appointments, 15-minute advising appointments on specific days. So you guys can sign up for any that are available. I do know they get booked out fast. So if you're going to have to wait a couple of weeks, we're sorry, but we will try to get to you as much as we can. But yeah, she'll drop a link in there for you. Okay, and one last question before we get to the financial aid section. Can you speak on why we have so many prerequisites? Oh my gosh, we know there's so many. We apologize. But our faculty, they just believe these prerequisites are going to be, huge indicators for success in the program. That's kind of the short answer. We just recently added nutrition and the lifespan. I do know the reason why we added those was because they were part of the curriculum, and it made, depending on the quarter of when those were offered within the program, it was just too intense. And a lot of the students were saying it was just too much on their course load. And so we looked into other programs offering those. And so we decided to make those prereqs to lighten the load once you are a student. So we do apologize. We know it's a lot. We really do. Okay, so we'll do a quick pause. We'll continue answering these, but I do want to share the video that Leonie has made for us. So let me do that and press this.
Hi, everyone. My name is Leonie. I'm the Director of Financial Aid at the School of Nursing. Welcome to our information session. I'm so glad you have joined us. In this presentation, I will be sharing an overview of financial aid at the School of Nursing. But if you have any specific questions, please feel free to reach out to us at financialaid@sonnet.ucla.edu. In this session, we'll be going over a few topics, including how to apply for financial aid, annual student fees and the cost of attendance for your program, how to fund your education, and important dates to keep in mind. To begin the process of applying for financial aid, you will need to complete a financial aid application. To know which application to complete, you can reference the information in the table on the right. Most students complete the free application for federal student aid, or FAFSA for short. Students that are not eligible for federal aid can apply for state aid through the California DREAM Act application. Now let's zoom in on annual student fees for your program. Annual fees are currently set at $26,116 for one academic year. If you are a non-resident, you will need to pay a supplemental tuition fee of $12,245. Fees are assessed quarterly, so a resident student would pay about $8,705 in tuition and fees each quarter. Student fees include UC-wide and campus-based fees. You can find a specific breakdown of all the fee components on the annual and term student fees page on the registrar's website. Health insurance coverage is mandatory for all students. Students are automatically enrolled in the UC-SHIP health insurance plan, which has a fee of $4,714 per year. The UC-SHIP health insurance requirement and fees can be waived if you already have adequate insurance coverage. The cost of attendance, or COA for short, is an allowance based on the educational expenses that students might incur. So the COA includes direct and indirect costs, and it's also the maximum amount of financial aid students can receive during an enrollment period. You will see in the pie chart the different components of the cost of attendance. The total projected budget is currently $61,382. You'll see that tuition and fees is just one part of that component. The rest also include room and meals, books and supplies, transportation, health insurance, and even loan fees. Both students can fund their education in a combination of ways, through scholarships, loans, and working at UCLA. Grants or scholarships is gift aid that you won't have to pay back. And those include fellowships through the graduate division, which you can apply to on your application for admissions. And all students who submit a financial aid application and a School of Nursing scholarship application will receive some sort of scholarship funding. That can include scholarships that are based on your program or interests, need-based scholarships like the Audrey N. H. Mosley Scholarship or HRSA Scholarship for Disadvantaged Students. We also have merit scholarships, and we always encourage students to expand their scholarship search and look for outside scholarships. Loans is borrowed money that you will need to pay back. This includes direct unsubsidized loan, which can be offered up to $20,500 per academic year, a direct graduate plus loan, which is based on students having adequate credit, the DREAM loan for our DREAM Act application students up to $4,000 annually. Nursing students also qualify for a nursing student loan, and there are also a lot of private loan options. Lastly, some students choose to work at UCLA. So this requires, of course, that you work and you earn money or employer-paid benefits. So either you can qualify for federal work study and be a work study student somewhere on campus. There's also academic apprenticeships where you can qualify for fee remissions, and UC employees. So eligible regular status UC employees can qualify for a 2/3 tuition reduction in the student services and tuition fees. Now, before we end our presentations, I want to highlight some important dates. Each year on October 1st, the financial aid applications open. On November 1st is the deadline to apply for fellowships through the graduate division. March 2nd is the financial aid application priority deadline. So you want to make sure to submit your FAFSA or DREAM application by this date. In May, typically our School of Nursing scholarship application opens, and this is shared with students after they are admitted. And in June is when our scholarship application deadline is set. You can find more information about financial aid at the School of Nursing on our website at nursing.ucla.edu/financial-aid, or feel free to email me your specific questions at financialaid@sonnet.ucla.edu. Thanks for listening.
All right. Okay, thank you everyone for hanging in there to see the last portion of today's information session, which is the financial aid. Again, to get a more up-to-date, specific, costs in terms of what it is, feel free to click on that link, which is our information packet. You're gonna have more up-to-date there. But in terms of the dates on when to apply for FAFSA, when scholarship deadlines are, all of that is relevant. So once admitted into the program, you will receive an additional information in terms of what that entails and what that looks like to help you also make a decision in terms if you would like to start with us in the fall. So excuse me. So this does conclude our information session. We just want to say thank you everyone for joining us. We did want to make sure that we are staying right on track, so we're excited about that with a few minutes to spare. So again, for those that want to hang tight, just to kind of see what questions we have here that we'll go ahead and answer out loud, feel free to stay. But if you have somewhere to go, if you need to pick up some kids or friends or relatives or start dinner, depending on where we are, feel free to log off. Again, please reach out to us if you have any additional questions. We will be here to help you as you make your decision to apply for this this upcoming fall. So again, just want to say thank you everyone for joining us, and we'll keep the recording going to answer some questions before we log off. Okay. Would working as an ED tech or a CNA at UCLA Health count towards work study or tuition reimbursement? So that's a good question. And so as long as you work at UCLA or UCLA Health as a career employee, you will be able to receive 2/3 off that tuition. So it's not just for nurses. So as long as you are a career employee, you would have the opportunity of receiving tuition reimbursement. So that does help. Okay, let's see what else. Generally speaking, has admission rates been decreasing steadily every cycle? No, it has not. It's probably remained pretty much the same. Actually, from last year, from 2024 admissions to 2025, we saw an increase by about 40 or so applications. But you never know. I mean, it does differ from year to year. I wouldn't say a decrease though. We won't know, in terms of what it's going to look like, right, until after, this year's deadline. But that's a good question. Let's see. I got some more coming in. Sorry, it just keeps moving on me. Besides tuition, is there any money we have to pay up front in terms of uniforms and supplies? Yeah, so that's a really good question. So yes, you will receive that during the welcome once you're admitted. We have orientation. We have a lot of things that our student affairs office will tell you about. I think they've also tried to make it built into the tuition as well. So they do let you know prior if you're going to have to pay anything before the start of the program. We do have it to one of our student groups. They do put on a drive where for our graduating students, if they want to pass down or leave the scrubs, let's say for the uniforms, they do leave them for our, newly admitted students or incoming students. So we do have that happens as well, just in case finances, does become an issue for our students. Okay, let's see. Someone is asking, it looks like this is the second time someone's asking, what is the difference between a MECN program and a BSN or a BSN, which is an accelerated BSN? A quick answer is master's entry, right? So the degrees would differ. So someone from our MECN program is going to graduate with a master's degree compared to the ABSN or even a BSN. More specifically, within our program, again, we do offer that public health certificate, which other programs don't. You also want to think about for our master's program, our students do their clinical rotations through UCLA Health, where other programs don't, unless you're at Mount St. Mary's. So as you guys know, UCLA is one of the best teaching hospitals here on the West Coast. So that means our students are going to be getting the best teaching experience in their clinical rotations. So that's something to think about as well. Prestige of the program goes a long way, networking. So there's quite a few things that we think can make our program help prepare you to be, a successful nurse. Good question. Do you have to worry about applying for fellowships? No, Leonie will provide you with that information once admitted into the program. Someone's asking, are we allowed to get a recommendation from a lab teacher? Yes. So even though we don't require the lab grade, doesn't mean that you cannot use that person to write you a letter of recommendation. Okay, does having high grades in your prerequisites help with your application if your bachelor's GPA is slightly below the recommended 3.4 to 3.5 range? So first, it's not recommended to have a 3.4, 3.5. It's just the average GPA of students that are admitted. Our recommended GPA is the minimum, which is a 3.0. So as long as you have a 3.0, you're good to go. For someone that does not have a 3.0, we do highly recommend that your prereqs are completed with A's and B's, even though C's, again, are acceptable. Okay, let's see. Are there any support programs for these courses? Since there are more hands-on courses, I assume there's a different method of tutoring. Are you talking about the prerequisites or are you talking about the courses once you're in the program? Because once you're in the program, yes, we have tutoring available for our students, just like for our undergrads, we have for our grad students as well. So yeah, we had different resources available for our students. If you're talking about the prereqs, we don't have anything for our for applicants, unfortunately. Okay, so sorry, let's see. Sorry, it just keeps bouncing around. I currently work for UCLA Extension Hospital and volunteering at Kaiser. Should I consider volunteering for UCLA? I'm not sure how to answer that. Yeah, I would just separate it as if you're volunteering somewhere, put that as volunteering in your resume. And if you're working somewhere, put that as working. Are there any workshops to help with statement of purpose or personal statements? We don't offer any workshops, but I'm pretty sure there are some really good ones if you want to Google them. But unfortunately, we don't provide specific workshops on the statement of purpose. Okay, someone's asking, how do you submit prerequisites taken outside of the bachelor's degree? So there's going to be a section where you're going to upload your transcripts. It's going to ask for your undergrad, which is your bachelor's degree. So you upload your transcripts, and then it's going to ask if you've completed any courses outside of your bachelor's degree, if it's at a university or a community college. And so it's also going to ask you to upload the transcripts there. Someone is asking, would you recommend applying again this year if they applied the year before and rejected? Yes, I would definitely recommend applying. It's all about what you've done in the year since, in terms of gaining more experience in healthcare, understanding nursing, just things that you think would make your application stronger. I would definitely recommend that. And I think you also would you recommend applying to other programs? Yeah, we also recommend that as well. Just in case um, you are not admitted into one program, you may have the opportunity of being admitted into the other. You definitely want to have, more options available. So yeah, we definitely recommend that. Someone's asking if you have a GPA under 3.0, do you require a supplemental essay? No, there is no additional essay for those that have a GPA under 3.0. Someone's asking, how much does the name/rigor of our undergrad college matter? Well, I'll say you don't get extra points depending on where you graduated for your undergrad, so I'll say that. As for graduate housing, does UCLA cover a portion of the cost? No. So if you wanted to get graduate housing, that would be up to the student to have to pay for it. I mean, scholarships can help pay for it, loans and so forth, but that would be an additional cost. Someone's asking, can I have a pending class? Yes, you can, but it would need to be completed before the end of this fall semester or quarter. Remember, you cannot have any classes outstanding after January 15th. And after you complete the course, you can provide us with an unofficial transcript or an official transcript. It's up to you. All right, another good question. For clinical rotations, are we able to choose ones closer to where we live? No, we have our clinical placement team that will do kind of, what do they call it? lottery. I don't want to call it lottery, but it's wherever the hospitals and the clinical rotation openings that are available that we'll send our students to. So it's not based off location. Someone is asking, do we include high school experience as well? You can, if you feel it's relevant, but we do want something that is more recent. But yeah, you can include high school if you like. All right. I like that kind of, speed, Q&A. So I know about half of the people have logged off, and so I'll at least stop the recording for now. And